was about to brave the cold with my boy Monkey. So I'm going to answer this question because it's something that I have a great deal of interest in. So you talked about edema in the legs, okay? And when it comes to COPD, lung disease, heart disease, edema is something that's very, very important to keep tabs on. So when you talk about why your legs swell when you're on your feet all day, fluid anywhere in the body is going to work based upon gravity. So as you stand, gravity is going to bring that fluid down. Now, under most circumstances, and as long as the fluid balance is in control, most people's vasculature, or the vessels, okay, are going to constrict and dilate in order to control that fluid, in order to work its way back up, and in order to rid itself from the body, okay? The compression stockings work just by what they sound like, by providing a compression that almost does the work of what the vessels are supposed to do when they constrict. So what are the things that you have to know about this? And I will say that our talk the other night with Dr. Evelyn Horn about pulmonary hypertension and heart failure, we talked about this situation a lot. So these are the things I would be concerned of. First of all, if you have this excess fluid in your body, my question would be why, okay? Is it a renal issue, a kidney issue, meaning that you're not evacuating it properly? Is it a heart issue, meaning that your heart is not pumping strongly enough and fluid is backflowing into the lower extremities? Is it a vascular issue, meaning that you don't have the right vascular tone, or you have peripheral arterial disease or peripheral venous disease that are not allowing that fluid to be pumped back up properly? Lung disease itself is not, lower extremity edema is not really a classic lung disease issue. In other words, people with chronic bronchitis, one of the symptoms is not usually swelling in the legs. People with emphysema, one of the symptoms is not usually swelling in the legs. People with asthma, one of the symptoms is not usually swelling of the legs. So my feeling is, at least to some degree, we have to look at the heart a little bit, and that's what you should ask your doctor about, especially in light of the fact that we know that people with respiratory disease are going to be more prone to heart failure, both right-sided and left-sided heart failure. And we also know that they're going to be more prone to pulmonary hypertension. And we also know that they're going to be, I was going to say heart failure. So again, people with pulmonary disease are going to be more prone to pulmonary hypertension, which can lead to and or be caused by heart failure. Don't get scared. I'm not saying that you have heart failure, but these are things that we have to keep in mind. The other thing, as Dr. Horn mentioned the other night, is that salt is a crucial aspect of fluid balance. So in other words, if all of a sudden you start eating excess salt, your body is always monitoring the chemistry, and it's always trying to make sure that you have the right salt to fluid balance. So if all of a sudden your body is much more salty, and this was very interesting what Dr. Horn said, she said that your body assumes that you're losing blood, right? So it assumes it's blood loss, but it's really that all of a sudden your body has gotten more salty, and as a result, it's going to try to keep that fluid in to help make your concentration of salt in your body less. So for anyone with pulmonary disease, anyone with cardiovascular disease, anyone prone to pulmonary hypertension or systemic hypertension or congestive heart failure, salt is your enemy, okay? So those are things to keep in mind. The good news about, or I should say the other thing to keep in mind, is that when you are inactive, okay, so a lot of times people with COPD, people with lung disease, people with congestive heart failure become much less active, and the inactivity can actually make the calf muscles much weaker, and the calf muscles are the main pump that brings fluid back from the lower body up to the rest of the body where it can be processed. And the other thing is that we sometimes lose vascular tone, meaning that we lose the responsiveness of the blood vessels to be able to dilate and constrict normally when we're inactive. So in this case, I would speak to your doctor about possibilities of compression stockings as a temporary fix. Compression stockings really only have to be used when you're in the upright position where gravity is going to bring that fluid down. They don't have to be used when your legs are elevated or when you're in bed. But the other thing to keep in mind is that use this as a temporary tool in order to start the process of doing deep breathing exercises, starting to get you more active so that we restore that normal muscle tone in the calves, the pump, and hopefully start to restore some of that vascular tone. But the key points to keep in mind: people that should be involved in this care, your internist or your general practitioner, your pulmonary doctor, think cardiovascular doctor if you haven't had a cardiovascular workup, and also potentially a peripheral vascular doctor, okay? I hope this has helped. It's a lot of information. It's very interesting information, and it's important information. So I will also repost the link to Dr. Horn's webinar, which will also give you further information about this, okay? Last question of the night. Have a good one. Take care. I'm Noah Greenspan.